citizens. It's for this reason that we believe that this House will prohibit all private health care. So before I go into our points today, I'm going to look at the definitions that we're going to use for this resolution today. First of all, prohibit will be disallow legally, and this will be carried out by the federal government. Secondly, this House will be all liberal democracies, Western liberal democracies. And thirdly, private health care will be medical services provided without the funding or influence of the government. And this will not include non-necessary cosmetic surgery. So the model that we're going to use is that we're going to implement this over the period of time necessary based on the country. So a country like the United States would obviously require a lot more time and effort to implement this resolution, while a country like Canada wouldn't need as much time and therefore would use a shorter amount of model. So also we're implementing the fact that the citizens won't be paying for things like prescription drugs. So we're basically giving them all the medical services necessary for them to live a healthy life in our societies. So the 3 points that we're going to use today are, first of all, that the fact that we won't have any private health care will force more improvement in the public system. Secondly, that health care is a basic right and that no one should have any more health care than anyone else based on their wealth. And then thirdly, that this will improve working conditions for those who work in the healthcare system. And that's the one that my partner will expand upon. So first of all, we can see that if we eliminate all private health care, this will force improvement in the public system. So we can see that currently, especially with countries like Canada and the United States, and I'll take you a moment, doctors in Canada have the option to go to the United States and make more money, and therefore have a better livelihood working there than they would in Canada, where they would work in the public system, yes.
How does granting a government monopoly necessitate change in the system?
Well, I'm going to explain that in a moment, actually. So we can see that currently they have a choice. They can go work for the private system, where they're going to get more money, and they might even have better working conditions, or they can go work in the public system. So we can see if everyone works in the public system, then there's a lot more pressure for change, because there's no other option than to work in the public system. So every doctor and nurse who works in the public system, and all of the patients who have no other option than to receive their health care in the public system, will therefore be able to put more pressure on the government, because those with the most influence, with the most wealth and the most power in society, will no longer have the option of spending their money to get medical services quicker. So everyone in society will have the same amount of healthcare services, and therefore will exert pressure on the government to improve these services and to spend more money on these services. Yes?
But shouldn't we be allowing people to achieve the maximum amount of healthcare that they can afford?
Well, no, in fact, what we think is that we should think that the most affluent members of our society should be fighting for healthcare for everyone in the society. So we can see that they shouldn't, just because they have more wealth, because they have more power in the society, be able to get quicker healthcare, be able to get better healthcare just because they have this wealth. And I'm going to go into this a bit more in our second point, because we don't believe that just because someone has more wealth, that they should be able to have any different healthcare than someone who has less wealth. So even though they're fighting for we believe that in fighting for the best healthcare for themselves, they should be also fighting for the best healthcare for their entire society as well. So the second point that I'm going to look at today is the fundamental nature of healthcare. And we've seen through various examples, through a comparison of public systems and private systems across the world, that we have a lot of problems when we look at private systems, because these systems allow for citizens to go to pay their money, to use the money that they've obtained, however, to obtain healthcare that is not available to the least affluent members of a society. So we can see that this isn't really fair in our society with the rights that we uphold. Because we can see that everyone has the same rights to basic living conditions. And on side proposition, we believe that a part of these living conditions is a certain level of health care. No, thank you. So, and as I've explained, the fact that we have a private system coexisting with a public system for certain services, and also between different countries, diminishes the quality of the public system, because there's this brain drain effect onto the United States, because there's less doctors who would want to work in a public system when they're not going to receive the same wages. So what we believe is that we shouldn't allow this private system, because it gives different rights to citizens with different amounts of money, and because it allows for citizens who have the most money to change the healthcare system so that they will be the ones receiving the most healthcare. And they're not really the ones who need the most healthcare in many cases. So we believe that it's important for our societies to support healthcare that's equal for everyone. And we believe that it's important to not allow these two systems to coexist, because the simple fact that they're coexisting causes the public system detriment. So for these two reasons, the fact that the removal of the private system forces improvement in the public system, and secondly, that healthcare should be even for everyone, we believe that this resolution must most definitely stand.